I'm Dr. Ben Newman. I'm a coronavirologist. Yeah, they exist. Yeah. At least yeah. At least I try my best to be. Next question is from Jessica, and good morning again, Jessica. All right. So let's see. The question is: generally speaking, what's the age range of children when children are referred to in COVID studies and guidance? Yeah. Is it primarily elementary ages or perhaps up to age 18? It differs in different papers. That's a totally unsatisfying answer, isn't it? Yeah. You have to look at the actual paper that this advice is coming from. So there was one looking at what are the symptoms of multi-system inflammatory syndrome associated with COVID, which is MIS-C, which is the dangerous kids version of COVID-19. And that one broke it up into age groups like newborn to 5, 6 to 10, 11 to 15, and 16 to 20. So somewhere between birth and 20. There are other studies that have only looked at newborns. There are other studies that have looked at school-age kids. The studies on, let's see, MIS-C, like the inflammatory syndrome that's really dangerous for kids, showed that the highest incidence of the severest disease was in the youngest children. So the 0 to 5s were the ones that really got hit the hardest by the virus, which is, kind of weird and bad and shocking, and it would make you want to keep them safe and okay. But that study also did go up to 20. The studies of heart damage. So I'm thinking of two different studies. The one had a median age of 8 years old, I think. I think the other one was a little bit older than that. I do not remember exactly. It was probably somewhere around 10 years old, something. But they generally, when people do these studies, they are gathering up all the kids in a particular hospital or a particular area. So these are usually studies that are going to be done by people who are doctors at a hospital that happens to be seeing a group of children. They have a group of children come in. And so they're basically using this paper to report what it is they're seeing and what it is they're finding, and so that other people can know, so that other people have their experience. It's a really nice experience sharing thing. That's kind of scientific literature at its best. You see something, you warn everybody else, like, look, this is what I saw. May or may not be the same for you, but forewarned is forearmed, right? So, when we're talking... Now, if we're talking guidance, guidance is different, So guidance is what different groups are telling you to do. And so the guidance, I think in the state of Texas, I thought it was if you were under, I don't know if it's 9 or 10, I can't remember, then you didn't have to wear a mask. That will vary state to state and probably city to city. Those are arbitrary numbers that are decided by somebody, pictures in their mind's eye. Like, okay, you got an 18-year-old, they could be sensible, maybe, yeah. You got a 14 or 12-year-old, you could probably get them to wear their mask most of the time. Just there'll be some lapses. And then they're just going back in their mind to like, okay, what's the youngest child I remember, or the youngest I remember my kids maybe, when they would probably be okay wearing a mask. And so, they're completely arbitrary. And you can look online, you can see people that have got little tiny newborns basically wearing masks, and it's okay. Anybody of any age can do it, if there's no other way to keep that person from being exposed, then that's the next best option. Not getting exposed in the first place is very much the best option. And then mask is number 2. And then, beyond that, it's a pretty steep drop off the cliff into bad idea territory. But, that's it. So guidance is kind of all over the place, and I would say that the virus doesn't care how old you are. It will infect, and it can spread from very young children to adults, or to young children to adults to the grandparents, something like that. All these things have been documented. Yeah, I know of instances of a couple of these things. It's just something that happens. It's what the virus does. So, yeah, I would say err on the side of keeping everybody safe if you can. That's the way to do it. When guidance tells you it's okay to take off your mask, it's probably not actually okay to take off your mask. And you want to avoid being in a situation where you don't have a mask and are in the same vicinity as other people in general. That's the safest way. That's what's keeping some of us safe anyway. As again, the virus seems to be closing in around me and maybe around you. There's yeah, people all over the place here at work that are coming down or getting exposed, stuff like that. And I hate to see it, and most of it is preventable. But yeah, most people are taking precautions and trying to do a good job. So that's all we can do. Take whatever precautions you can and get as much out of life as you can while taking full precautions. There you go. So thanks very much. I don't know if that completely answered your question, but yeah, it depends is just such an unsatisfying answer, and so I've given you a little bit more than you wanted probably. Thanks very much. This is Ask Dr. Ben.